pleasure. So nice to meet you. I'm Alex. I work at BC Platforms as a key account manager, and I'm a scientist by background. I'm based in Paris, and I've been working in clinical trials and clinical science for a very long time. So since the start of the BRECISE project, we are actually in charge of sourcing both clinical data and tissue from different regions and leveraging our technologies that support compliant sharing of personal data. So we have been reaching key objectives in sourcing patients from France, from a Parisian hospital, and also from a US hospital, healthcare systems that is based in US that will come and complement this international cohort. So we have been going through a lot of contractualization, ethics process, protocol approvals, and so on. But today we have KOLs who are kind of enrolled in the study. We have identified the patients, and we are looking forward to Q2 and Q3 to proceed and ship the first tissue to the central lab that is also part of the consortium, and that's going to start the actual analysis of the tissue together with the clinical data to support the biomarkers development. So pretty excited about what's coming up. So I think when we work on retrospective patient identification, it's always a challenge to go deep into the clinical data, the IE criterion of the study, and make sure that we are going to be able to provide a significant amount of patient and tissue. So this is very much like a groundwork we are operating with our data partners, both in France and in the US, in order to make sure that we are going to end with a significant pool of 700 patients in total, both clinical data and tissue to support the consortium. So we are very much in prostate cancer, but we are also exploring opportunities to go and source bladder cancer. So within the BRECISE consortium, we actually collaborate pretty closely with two companies that are doing like ArenaSec and data analysis. We run a very small proof of concept study in order to make sure that we could have the right process, the right quality of tissue. So we are very much collaborating with both the hospitals, of course, IMM and Sutter Health, but also with Ralph Hoffman from Philips Healthcare and Omics Bio and other CROs. We're also working with Crown Bioscience to source fresh tissue from our data partners. So pretty collaborative approach, and we help each other to mitigate risks and reduce the timelines, I would say, because these are long process. So as I said, the next year for us is going to be unlocking the access to the tissue and the data for the companies who are in charge of the analysis, and this is very much where we are focused on. If we go into the details of our operating work with the hospitals, we are working both with the legal teams of the hospital to make sure we comply with the regulatory requirements, but also with the technology infrastructure teams, because we set up the software that can allow the sharing of multimodal data sets, including the clinical data, the imaging, and the analysis from the tissue. So we are setting up a workflow in terms of IT that takes a long time to be validated, approved, and installed.